Going to present some details about the EBC MAIN European Bifurcation Club trial, which I hope will be hotly anticipated when we get to present the actual results. So this trial has been going for some time, as you know, started in 2015. In fact, it's the European Bifurcation Club left main coronary study, and it's a randomized comparison of the provisional versus the systematic stenting strategies for true bifurcation left main coronary lesions. The hypothesis of this study is that left main true coronary bifurcation lesions are best treated with a stepwise provisional stent strategy rather than a planned dual stent strategy. As Jens Lassen wisely says, when you start with one stent, you can always end up with two, but when you start with two stents, you can't end up with one. The primary endpoint at 1 year is death, target lesion revascularization, and MI at 1 year. So the study design is multi-center, prospective, randomized. There's 450 patients in the study, 30 centers and 10 countries. So it's been a very large effort getting this together, and this has been coordinated through CERC. Medtronic provided an unrestricted grant, and the stent used in the study is the Medtronic Onyx. Briefly, the main inclusion criteria were that patients should have a bifurcation distal left main stem stenosis greater than 50%, and they should have ischemic symptoms or a positive non-invasive test or positive FFR or left main stem IVUS area less than 6 square millimeters. Of course, it had to be a true bifurcation type, and the LAD and circumflex both had to be large enough to warrant stenting. The techniques are sometimes misunderstood. The provisional approach is a step-by-step layered technique. It's not a sort of one stent technique as such. It is a method of gradually increasing the complexity of the procedure until you get the result that you need. In this study, the POT will be mandated and the KISS will be mandated because both branches are important and both have significant disease. On the systematic approach, this will be up to operator choice. There are reasons why people will prefer one technique than another, and the various two-stent techniques are all allowed within the study. We're expecting people to undertake high pressure, as it were, ostial dilatations of the vessel and to do a final KISS plus or minus POT. The recruitment was slower than we might have hoped because it's difficult to recruit these kind of patients in Europe, and so it's taken a good 4 years to have complete recruitment. Congratulations particularly to centers such as the Newcastle Centre, Mohamed Egred, Oxford and Fontaine-les-Dijon also recruited very heavily, so a range of recruitment. And so now we come to the demographics, and this is just a teaser really, because the study is now under analysis. The final patient went in November of last year, so they're at a year of follow-up just coming up. In the final analysis, we have 224 patients in the provisional group, 229 in the systematic. The age of the patients, roughly 70 years old, unsurprisingly 75% male. Perhaps interesting to see the diabetic rates. A quarter of the patients are diabetic, not surprisingly, and a reasonable high-risk patient group in that a quarter have had a previous MI and some have had previous strokes or existing renal failure. So this is just a teaser for the final results, which will be available at PCR 2021 if the abstract is accepted. And I think it will be very interesting to see how these results compare with the previous trials. Thank you.